Diabetes by Stella Kill. Diabetes is a disease that occurs when your blood glucose, also known as blood sugar, is too high. Blood glucose is your main source of energy and comes from the food that you eat. Insulin, a hormone made by the pancreas, helps glucose from food get into your cells to be used as energy. Sometimes your body doesn't make enough or any insulin, or doesn't use it well. Glucose then stays in your blood and doesn't reach your cells. There are two types of diabetes. If you have type 1 diabetes, your body does not make insulin. Your immune system attacks and destroys the cells in your pancreas that make insulin. Type 1 diabetes is usually diagnostic in children and young adults, although it can appear at any age. People with type 1 diabetes need to take insulin every day to stay alive. If you have type 2 diabetes, your body does not make or use insulin well. You can develop type 2 diabetes at any age, even during your childhood. However, this type of diabetes occurs most often in middle-aged and older people. Type 2 is the most common type of diabetes. Type 1 diabetes is an inherited condition, and individuals with a first-degree relative who have the condition are at risk of developing the condition. Some genes have repeatedly been identified in people with type 1 diabetes. Examples of genes such as HLA-DR3 or HAL-DR4 genes. Carrying these genes raises the risk that offspring will inherit type 1 diabetes. Genetics play a role in type 2 diabetes as well. Genes that lead to insulin resistance and lowered insulin production can lead to type 2 diabetes, as well as ones that code for obesity. However, for type 2 diabetes, lifestyle plays a major role. So, inherited lifestyles practices for many family members can lead to obesity and the development of diabetes. Diabetes contributes to high blood pressure and is linked with high cholesterol, which significantly increases the risk of heart attacks and cardiovascular diseases. Diabetes affects our blood vessels and nerves and therefore can affect any part of the body. A relatively common complication of diabetes is diabetic retinopathy. Furthermore, blood vessels and veins can become swollen and kidney problems can develop. Obesity is another major effect of diabetes and can lead to joint problems. People more at risk for developing type 2 diabetes are individuals who are obese and have unhealthy lifestyles. Lifestyle choices include eating an unhealthy diet and not exercising properly, or what can lead to obesity and can contribute to the development of type 2 diabetes. People who have diabetes that run in their family are also at higher risks. So, to prevent diabetes, it's key to stay active and have a healthy, low-sugar diet. Maintaining a healthy weight is key, and having regular checkups with your doctor, as well as monitoring your blood pressure, are also ways to help prevent and monitor diabetes.